Hello, good morning everyone.
Good morning, ma'am.
Okay, so today I will take the one embryology, general embryology class. You have already know about the germ layers, how they are formed. That is, there are three germ layers are there. One is the ectodermal germ layer, another is the mesodermal germ layers, another is the endodermal germ layers. Okay, so from all these germ layers, all the structures of our bodies are formed. So today I will tell that what are the structures formed from the ectoderm. Okay, so what are the structures formed from the ectoderm? So this is the at the beginning of third week. You can see that the embryo is implanted, and you can see the embryonic disc where there are two cell layers are present. These are the embryoblast. They will divide into two types of cells. And the blue one is known as the epiblast, and the yellow one is known as the hypoblast. The hypoblast and the epiblast, these two layers are present. Now from these layers, particularly from the epiblast, all the germ layers are formed, and the hypoblast that will disappear later on. Okay. So this germ disc, if we see on the 15th day, that is the beginning of the third week, beginning of the third week is the 15th day. So at that time you can see that the embryonic disc is more or less circular, and there is one groove will appear near its caudal part. So where the groove will appear, that is the caudal part of the embryonic disc, and that is not present throughout the embryonic disc, but only in the caudal part it is present. And in front, that is a groove, and in front of that there is some elevation that is known as the primitive node. The groove is continued into the primitive node as the primitive pit. There is a opening, there is an opening in the primitive node, that is the primitive pit, which is continuous with the groove of the primitive streak, and surrounding that this is the epiblast, and below this is the amniotic edge, cartilage of the amnion, and the yolk sac. Okay, and the yolk sac that is here deep to the, that is below the epiblast, there will be the hypoblast. Okay, now when this primitive groove and primitive streak is formed, then the epiblast, some epiblastic cells, they migrate towards the groove present in the primitive streak, and also they pass through the primitive node. So if we cut it in this layer, you can see that this is the epiblast. Some cells of the epiblast, they are passing between the epiblast and the hypoblast, and they will form the mesodermal germ layers. And the some of these cells, they will replace this hypoblast cell. The hypoblast cell gradually disappear, and that will be their place will be taken by these ingressing cells, epiblast, and they form the endoderm. So from the epiblast, both the ectoderm, the mesoderm, and the endoderms array. So ectoderm, mesoderm, and the endoderm are formed from the epiblast. So all the germ layers are formed from the epiblast. Now this is the circular disc. Later on it becomes elongated, and it becomes wide in the front than in the back, that is in the caudal part. Caudal part it remains narrow, and in the cranial part it becomes wide, and it is more or less slipper shaped. And in this region, the epiblast, that is the ectodermal germ layer, and the endodermal germ layer, they are fused with each other, both cranially as well as caudally. So cranially, that is known as the buccopharyngeal membrane, and caudally, that is known as the cloacal membrane. That has not been shown here. That will happen. So that is these are the two areas where the ectoderm and the endoderm is fused. Now, the cells which pass through the primitive streak, they will pass cranially or headwards towards the oropharyngeal membrane or the buccopharyngeal membrane and form the notochord. That notochord, it is the mesoderm, and it will form a part of the vertebral column. And in front of the notochord, between the notochord and the buccopharyngeal membrane, there is the part of the mesoderm is known as the precaudal mesoderm, from where the heart will be developed. Okay, so that is the notochord is formed. Then after that, this is the sagittal section. Here you can see that there will be the primitive streak here, and this is the primitive pit. That is the opening present in the primitive node, and through that mesodermal cells or the epiblast, which will convert it into the mesoderm, that will pass headwards and that will form the notochord. And in front of the notochord, between the notochord and the buccopharyngeal membrane, here you can see the ectoderm and the endodermal germ layers. They are fused with each other. So that is the buccopharyngeal membrane. Similarly, behind, posteriorly or caudally, you can see the cloacal membrane, and this is the notochord, and this is the precaudal mesoderm. Precaudal mesoderm, this is notochord. And the primitive pit, now it is continuous with the amniotic sac, that is known as the neuroenteric canal. But this neuroenteric canal and the primitive streak, all this, they are very transient structure, so they will disappear after some time. Okay, so they are neuroectoderm, and over the notochord, that is this notochord and the precaudal mesoderm, they will induce the overlying epiblast or the ectoderm, and these ectodermal cells, then they become elongated and become columnar, and they will form a new type of ectoderm that is known as the neuroectoderm. So from this neuroectoderm, the nervous system will be developed, isn't it? So nervous system will be developed from the ectoderm. Okay, so this is the ectoderm. So ectoderm is present superficial to the mesodermal germ layer, and from that layer the neuroectoderm is also formed. So the nervous system is also formed from the ectoderm. Now by the side of this neuroectoderm, there will be the cells, the ectodermal cells, that is known as the surface ectoderm. Now from the surface ectoderm, what will be formed? The skin, that is epidermis, dermis, and the appendages of the skin, that is the hair cells, then the sweat gland, sebaceous gland, nail, hair, all these structures are formed from the ectoderm, along with the nervous system is also formed from the ectoderm. Now there will be some changes occurs in the neural plate, and these changes together, they are known as, that process is known as the neurulation. So in the neurulation, there will be some changes, some changes will occur in the neural plate. This neuroectoderm, now it is known as the neural plate, and this neural plate then converted into a closed neural tube. And when that closed neural tube is formed, that process from the neural plate to the closed neural tube, that part is known as neurulation. So the neurulation, it is a process by which a neural plate is converted into a closed neural tube, not an open neural tube. When if the neural tube is open, that is incomplete neurulation. The neurulation will be completed when the neural tube will be a closed tube. Okay. So that is the neurulation. Now here you can see this is the embryonic plate, and in the embryonic plate the primitive streak is still there. They have shown the primitive streak which will regress later on, and this is the primitive node, and just over the notochord, this is the, if you take the cross section here, then you can see the notochord. Just over the notochord, this that is the ectodermal cells will be thickened and become columnar, and it is known as the neural plate. Now the surface ectoderm by the side of it will form the skin and its appendages. Now there are some cells are also present at the junction of the neural plate and the surface ectoderm, that is known as the neural crest cells. These cells are known as the neural crest cells. And the embryo at that time, when that neurulation occurs, the embryo at that time, it is known as neurula. So neurula is the embryo. That time that embryo is called as neurula. Now in neurulation, first there will be a depression in the neural plate, and gradually the two lateral edges of the neural plate will be elevated and they will come close to each other. They will come close to each other. So when they will be elevated, that depression is known as the neural groove, and the elevated lateral wall is known as the neural fold. And then these two neural fold, they come close together and they form the neural tube. Now when the neural tube is formed, when they come close to each other and the surface ectoderm also come close to each other, then these neural crest cells, they will be dissociated. They will be separated from both from the surface ectoderm as well as from the neuroectoderm. So they will be separated and they will be migrated to various places. And gradually the surface ectoderm, they join with each other over the neuroectoderm. The neural plate, they join with each other to form the neural tube. Over that, the surface ectoderm will fuse with each other and to form the skin over the neural tube. Okay. Now the fusion of the neural tube occurs first in the cervical region. So at that time, just below the epiblast, there is mesoderm, and that mesoderm, they are divided into various parts. So the parts of the mesoderm which is close to the midline, that is known as the paraxial mesoderm, that will be segmented and they form the somites. So there are many somites will appear. So at the level of the fifth somite, that is at the cervical region, the union will occur first. Then this union will go both cranially as well as caudally. And till then, that anterior opening is to the amniotic sac, that is known as the anterior neuropore, and the posterior opening is known as the posterior neuropore. And here you can see that the neural crest cells are separated from both from the surface ectoderm as well as from the neuroectoderm, and they are migrating. Okay. Now gradually the anterior neuropore that will be closed. That day is the 25th day. 25th day of intrauterine life, that will be closed. Whereas the posterior neuropore will be closed 28th day of intrauterine life. So after 28th day, the neural tube will be a closed tube, and then the neurulation will be completed. Okay, so neurulation is completed only after closure of the neuropores. So the posterior neuropore closes at day 28. So after about 1 month, the neurulation is complete. So the neural tube is formed. From the cranial part of the neural tube, the brain is formed. From the caudal part of the neural tube, the spinal cord is formed. So in the cranial part, you can see there are 3 dilatations are there. So from the cranial most dilatation, that is known as the prosencephalon, from there the brain and the thalamus part, that will be developed from the prosencephalon. Okay, so there will be various parts that you will know later. Then there will be another part that is known as the mesencephalon. From there, the midbrain will be developed. The midbrain will be developed from the mesencephalon. And then the lowermost part is known as the rhombencephalon. From there, the rest of the brain will be developed. That is the pons, medulla, cerebellum, they will be developed. and from there, after medulla, the part of the neural tube and the caudal part, that will form the spinal cord. So the central nervous system is developed from the ectoderm. So skin and its appendages, central nervous system. Now what other structures are developed? Now the neural crest cells, that is as the cells that will make many structures of our body are formed from the neural crest cells. So the structures which are derived from the neural crest, they are all derived from the ectoderm. Okay, so they are all derived from the ectoderm. So what are these structures? So they migrate both dorsally. So they enter into the skin, and there they will form the melanocytes, and they also migrate ventrally. So some cells, neural crest cell, they enter into the skin to form the melanoblast. They enter into the teeth also, and there they will form the odontoblast. They enter into the neural tube and they form the outer membranes of the neural tube, and that is the pia mater and the arachnoid mater. Dura mater is not formed. Dura mater is formed from the mesoderm. So pia mater and arachnoid mater. Then they enter into the peripheral nervous system. So peripheral nervous system and autonomic nervous system, they are also developed from the ectoderm. So these neural crest cells, they enter into the ganglion of this peripheral nervous system and the autonomic nervous system. So they enter into the ganglion of the dorsal root ganglion, that is the spinal nerve ganglion, and the autonomic ganglion, very sympathetic nerve ganglion, parasympathetic ganglion, everywhere they will enter. They will go to the plexuses surrounding the aorta. This is the aorta. In front of the notochord is the aorta, and they form the aortic plexuses. They enter into the gut wall and they form the enteric ganglia. They enter into the adrenal gland and they form the adrenal medulla. And also they form enter into the mesoderm of our head and neck region. That mesoderm is developed from the branchial arches. You will know later, the branchial arches mesoderm. So there they will enter. That will form the muscles, bones, cartilage of this head and neck region. Particularly the bones and cartilage of the head and neck regions, and the muscles also, they are formed. So they enter into this branchial arch mesoderm. Okay, and also they enter into the cardiac mesoderm, and they form particularly the cardiac skeleton there, that the neural crest cells, they enter. If they do not enter, their development will not be complete. Their development will be abnormal. So if the neural crest cells do not enter into the branchial arch mesoderm or into the cardiac mesoderm, then there will be the anomalies in the heart, or there will be anomalies in the craniofacial maldevelopment will be there. Also they will enter into the smooth muscle of the gut, smooth muscles of the respiratory tract, smooth muscles of the artery. So everywhere these neural crest cells are, most of the part the neural crest cells are developed, invading. So where the neural crest cells are going, the structures which are derived from the neural crest cells, all are derived from the ectoderm. So ectoderm gives rise to many structures of our body. So what are the neural crest derivatives? So they will form the melanocytes, they will form the odontoblast, they will form the pia arachnoid, they will also form the Schwann cell, that will form the myelination of our nerves. That is, Schwann cells are also neural crest cell derivatives. Also they will form the neurons of the dorsal root ganglion, autonomic ganglia, and also the enteric ganglia, that is gut ganglia, and also into the adrenal medulla. Also they will form the C cells of the thyroid, that is parafollicular cells, that is also known as ultimobranchial body. They are also these neural crest cells enter. Craniofacial skeleton, I will show you that some bones, they are developed from these neural crest, they are derived derivatives of the neural crest. connective tissue of the face, septum of the heart, mainly the conotractile septum, smooth muscles of the gut wall, the respiratory tract and the vessels, smooth muscle of some organ like bladder, uterus, vas, seminal vesicles, APUD cells. Where they are present? They are present in the gut, neuroendocrine cells of the gut, that is the APUD cells. Also, they enter into the corneal epithelium. The corneal epithelium, the neural crest cells also enter into the cornea. They also enter into the other parts, other coverings of the eye, that is sclera, iris, ciliary body, all this area that will be entered. So, neural crest cell derivatives, there are so many neural crest cell derivatives. Okay, you can see that these are the bones. They are derived from the neural crest. The bones which are colored blue, like frontal bone, squamous part of the temporal bone, sphenoid bone, maxilla, mandible. So they are all derived from the neural crest cells invade these bones. Okay. And the other bones, they are developed from mesoderm and from the mesoderm. Now, not only the skin, the surface ectoderm also thickened in various parts close to the neural tube. And this thickening of the surface ectoderm is known as the placodes. So here we can see the two placodes. There are so many placodes are present, but here I have shown only the two placodes. One is the lens placode, another is the otic placode. So lens placode, it forms the lens, and the otic placode, that forms the internal ear. So the lens is also developed from the ectoderm, and the otic placode, that will form the internal ear, that is the vestibular organ and the cochlear organ, although there is also some other parts are also there, but the epithelium, the sensory epithelium of the vestibular apparatus, the sensory epithelium of the cochlea, that will be formed from the ectoderm. And another structure is formed from the ectoderm, that is the pituitary gland. The pituitary gland, which is present inside our cranium, cranial cavity, that is the pituitary gland, and it has two parts, you know, the posterior pituitary and the anterior pituitary. Posterior pituitary is connected to the neural tube, that is, it is connected to the thalamus. Thalamus is developed from diencephalon, that is a part of the prosencephalon. So from the diencephalon, the thalami will develop, and from the floor of the diencephalon, there is the ectodermal thickening is there, finger-like thickenings are there, that will come downwards. And this is the mouth cavity. The mouth cavity is known as the stomatodeum, which is covered by only by the ectoderm. So mouth cavity is developed from the ectoderm, and from the roof of the mouth cavity, there is another elevation, evagination of the ectoderm, that is known as the Rathke's pouch. So there is a cavity also here. So that is Rathke's pouch. Now these two evaginations of the ectoderm, one from the neuroectoderm, another from the mouth ectoderm, roof of the mouth, they will come close to each other and fuse with each other to form the pituitary. And later on, this part which is attached to the roof of the mouth, that will be separated. But the part which is attached to the diencephalon, that will not be separated. So from this Rathke's pouch, this is the Rathke's pouch. From the Rathke's pouch, the anterior pituitary or adenohypophysis will be developed. So adenohypophysis, that is there are three parts are there. That part also surrounds the neurohypophysis, which is known as the posterior pituitary, which is attached to the diencephalon. Okay, so both anterior pituitary as well as posterior pituitary, they are developed from the ectoderm. The posterior pituitary from the neuroectoderm, and the anterior pituitary from the ectoderm of the roof of the mouth. So the pituitary gland is also developed from the ectoderm. So there are many structures which are derived from the ectoderm. So if we see from the surface ectoderm, skin and its appendages are formed, that is skin, hair, nail, sweat gland, sebaceous gland, all are developed from ectoderm. Placodes, there are so many placodes are there, all these placodes are ectodermal derivatives. So that is otic placode, olfactory placodes. So the lens of the eye, the olfactory epithelium, all are developed from the ectoderm. All are derivatives of the ectoderm. The anterior pituitary, that is also the part of the ectoderm. The neuroectoderm form the nervous system, that is the central nervous system. Also the autonomic ganglia, the neural crest derivatives will go, and the posterior pituitary is also developed from the neuroectoderm. And neural crest derivatives, I have already shown you that many structures are developed from the neural crest, about 18 to 20 names I have written there. So they are all derived from the neural crest. Okay, now there are some clinical correlations. So what will happen if the neural tube is not formed properly? So there will be neural tube defect. That neural tube defect may occur cranially as well as they may occur caudally. If they occur cranially, that is very dangerous condition. Sometimes through the gap of the neural tube, the whole of the brain may come out, and that will be degenerated. And when that will be degenerated, the cranial bones over that may not be formed, or if they are formed also, they will be collapsed over that area. So there will be no brain, and that condition is known as the anencephaly. Anencephaly. The head will be formed, but deep to the head, deep to the cranium, there will be no brain, or there may be a haphazard neural tissue may be present. That neural tissue may be vascular also, but it is degenerated neural tissue. So no brain. So the child will not survive, the baby will not survive. After birth it will die. Okay. Or sometimes there the gap may be small, and through that gap the some of the neural tissue may come out, that is known as the encephalocele. Encephalocele. So here you can see that through a gap which is present behind the head, through that gap the neural tissue is coming out. So that is the encephalocele. Sometimes it may occur over the head, and sometimes it may occur at the junction of the forehead and the nose, bridge of the nose, in this region. So here you can see another. So that encephaloceles can be treated by surgery. But when there is encephalocele, that means there are some mental defects, neural defects will be there. There will be that the limbs, they will be not, their power will not be there. Okay, there are the movement will not be proper, abnormal movement may be there, and there may be mental retardation. There may be the milestone may be delayed. Okay, there may be accumulation of fluid inside the skull, and usually the skull is small because some amount of brain tissue is come out. So the skull size will be small, the head size will be small. Okay, so that is even after surgery also, when they replace this neural tissue inside the cranial cavity, still there will be some signs and symptoms will be there. So that is in case of if the cranial part of the neural tube defect is there. In the caudal part of the neural tube defect, it occurs anywhere. It may occur in the cervical region, in the mid-thoracic region, but particularly it is more common in the lumbar region. In this region, sometimes there will be defect. Defect may be there, and the bones may not be formed. So in most mild cases, nothing will occur. There is a defect, but nothing has come out. Nothing has come out. Neither the meninges nor the spinal cord, nothing will come out through that defect. And in that case, there may not be any symptom. But sometimes there may be some dark pigmentation may occur at that region, and sometimes the hair follicles, there may be more hair follicles, and these hair follicles may give rise to a tuft of hair in this region, in the region of the defect. So that is known as spina bifida occulta. Occulta means hidden spina bifida. no symptoms, may not be. Sometimes only the meninges will come out and there will be mild symptom and there will be a sac of fluid may be present there in this region, and that can be also by surgery it can be replaced towards the spinal cord and nothing will occur. So only the meninges. But when the spinal cord, the sum of the substances of the spinal cord comes out, that is known as the meningomyelocele. Mylomeningocele or meningomyelocele, whatever. So that will come out. In that case, there will be some symptoms. That is the most severe case of spina bifida. So there will be abnormality in the limb development. The lower limbs, the patient cannot walk properly. Okay, the child cannot walk properly. There may be the bladder difficulties, bowel difficulties may also be there. Okay, so that is the myelomeningocele if it occurs in the spinal cord, that is in the sacral region, lumbosacral region, if it occurs in the lumbosacral region. Okay, so these are the some clinical condition if the neural tube defect. So this neural tube defect can be prevented. In most of the cases, this neural tube defect can be prevented by folate, by folic acid. So this folic acid, if this neural tube defect not only due to this folic acid deficiency, but it may also be due to some genetic factors also. So if there is any history, family history or the past history of the neural tube defect is present, then in that case, the folic acid tablets can be given, that is 400 microgram folic acid tablets can be given before conception also, and it should be continued throughout the pregnancy and also after conception. So it can be prevented by taking folic acid. So folic acid is present in many foods. So we can take the pregnant mother or the females, they should take this type of foods, that is the nuts, the legumes. This is avocado. I don't know avocado is available here or not. The citric fruit, then the oats, all these things. This is lettuce, this is eggs, broccoli, the tomato, all these carrots. So all these things. And this is the folic acid tablet, that is 400 microgram daily throughout pregnancy. Even before pregnancy, at least 1 to 3 months before conception, when if anybody has planned to get pregnant, then before conception also she should take the folic acid about 400 microgram throughout pregnancy and also after birth of the baby for about 3 months. Okay, so this folic acid that can prevent about 50 to 70% of the neural tube defect. So folic acid is very important to take because it is an important medicine for in pregnancy, during pregnancy. Okay, so again I have given the assignment. Okay, and that assignment it is here. Okay, so that is the your only three. One is the neurulation, what is it and how it occurs, how does it occur, that you have to write. The neural crest, what is it, where it has formed, and what structures are formed from the neural crest, and what is neural tube defect, not neural defect, there are so many. So what are the neural tube defects that you have to write. Okay, so please submit the assignments. Thank you.
Thank you.